So hello and welcome to our panel discussion, NIH Data Management and Sharing Policy, what is expected of researchers and how can libraries help? I'm Cecilia Smith, Director of Digital Scholarship at the University of Chicago Library, and I'll be moderating our session today. We're very pleased to have three panelists from the National Institute of Health to speak to us about the new data management and sharing policy at NIH. Before I introduce our speakers, I'd like to express gratitude to Adrian Ho, Scholarly Communications Librarian at UChicago Library, for his work organizing this event, and to Deb Werner, Director of Library Research and Medical Education and Librarian for Science Instruction and Outreach, also at UChicago, for helping us connect with our panelists. At the end of the presentation, our speakers will address the questions submitted prior to this session, and we'll move into a moderated question and answer portion. Please feel free to use the Q&A function in the Zoom platform, and we will read those questions as time allows. UChicago researchers may send any remaining questions to datasharing@uchicago.edu, and we encourage other attendees to reach out to the support services available at your home institutions. So let's get started with an introduction to our three speakers. First is Ellen Wan, who is Health Science Policy Analyst and Team Lead in the Scientific Data Sharing Policy Division at the Office of Science Policy at NIH. Over the past 4 years, she has focused on data management and sharing policy issues, software sharing best practices, public-private partnerships, consultation with American Indian, Alaska Native tribes, and scientific collection policy areas. She was involved in the development of the 2023 NIH Data Management and Sharing Policy, and is currently aiding implementation planning. Previously, Ellen was a AAAS Science and Technology Policy Fellow and a Society for Neuroscience Policy and Advocacy Fellow. Next, we have Cindy Danielson, who is Associate Director of Systems Integration in the Office of Research Reporting and Analysis, which is part of the Office of Extramural Research at the NIH. Cindy supports the management of reporting tools used for program management and analysis by NIH staff and members of the public, and coordinates data management and sharing policy implementation plans. She first joined NIH in 2013 as a AAAS Science and Technology Policy Fellow in the National Institute of Nursing Research Office of Science Policy and Legislation. And finally, we're joined by Lisa Federer, who is the Acting Director of the National Library of Medicine's Office of Strategic Initiatives, serving as Principal Advisor to the NLM Director on strategic directions of the NLM, including open science, analysis, evaluation, and reporting on the NLM programs and activities. Prior to this position, Lisa served as NLM's Data Science and Open Science Librarian, and previously served as the Research Data Informationist at the National Institutes of Health Library, where she developed and ran the library's data services program. And with that, Ellen, Cindy, and Lisa, I turn it over to you.
Thank you so much for the opportunity to speak with you today about the new NIH policy for data management and sharing. My name is Ellen Wan, and I'm a member of the Office of Science and Policy at NIH. And I will be presenting alongside my colleague, Cindy Danielson, of the Office of Extramural Research, and Lisa Federer of the National Library of Medicine. First, why is NIH interested in data sharing? And ultimately, what motivated NIH to issue this policy? There's a variety of different kinds of ways of motivating different data sharing policies, and that ultimately is reflected in the kinds of expectations they have. This particular policy has two main goals. The first is to advance the rigor and reproducibility of the research that is funded by NIH. In that way, data sharing enables the validation of research results, and making high-value data sets accessible is particularly important then also for research with significant investment. Data sharing is critical for accelerating future research directions and increases opportunities for members of a research team to have their work cited and for research collaboration. In addition to these goals that are scientific in nature, the data sharing policy was motivated by a public policy goal as well, and that is to promote public trust in research by fostering transparency and accountability and demonstrating good stewardship over taxpayer funds. One motivation that I won't talk as much about today, but is also absolutely critical, is research participants' contribution to science. And we view that data sharing maximizes research participants' contributions to science while supporting appropriate protection of research participants' data. NIH has long been committed to data sharing. We have a NIH-wide data sharing policy that dates back to 2003, and even prior to that, NIH long was interested in data sharing. Despite this long commitment to data sharing, there's a growing body of literature that shows that we still have more work to do in terms of data accessibility. These are just three papers from the last few years that show this issue related to data accessibility. The first, the authors evaluated data availability in 875 papers across 9 different scientific disciplines, including biomedical research. And these were papers published in Science and Nature between the years of 2000 and 2019. And what they found was that data, they couldn't obtain the data from authors in almost 40% of cases. And while that improved with repeated follow-up, almost 20% of requests declined altogether. And these were for a myriad of reasons, some of which were things like the data was no longer available, or the actual researcher noted that they didn't trust the requester, for instance. And then another paper that was noteworthy in this space is from Cancer Biology, where Arrington and colleagues attempted to repeat almost 200 experiments from high-impact cancer biology papers and found that they weren't able to obtain the data for almost 70% of those experiments. And more recently, this trend has also shown true when even when there's data availability statements in the publication itself. So these are all somewhat discouraging, but in reality, there's also lots of data sharing success stories as well. One that is noteworthy at NIH is that we have a genomic data sharing policy that went into effect in 2014 for the sharing of large-scale genomic data through NIH repositories, including the database of genotypes and phenotypes, or dbGaP. And what we've seen through dbGaP is that there's been hundreds of or tens of thousands of requests for that data from users around the world and from various sectors. And that's resulted in thousands of publications. This is made even more important when considering the evidence from this recent Pew Research survey, where Pew surveyed US adults about what was most important in terms of trusting scientific research findings. And they found that if data is openly available to the public, that's the most important thing for their trust in scientific research findings. With these issues in mind, and based on the motivations that I first described, we underwent a long policy development process that was iterative in nature. This policy development process really started in 2013 when the White House at that time issued a memo for large research agencies to make data publicly available. And we thought through strategies for doing so with consistent community engagement. So we went out for requests for information in both 2016 and 2018, and these ultimately shaped the the draft of this policy that went up for public comment in 2019 alongside draft guidance. We received over 200 public comments on the draft version of the data management and sharing policy, and those comments were considered in the finalization of this policy. In addition, we had numerous conversations with other agencies that are approaching data sharing, and received input from the Secretary's Advisory Committee for Human Research Protections. Additionally, NIH underwent a formal tribal consultation process where American Indian and Alaska Native tribes from across the country weighed in on this policy and its implications for their communities. Since 2020, when this final policy was released, we've continued to provide additional implementation guidance until the policy effective date, which was in January of this year. The data management and sharing policy itself is quite simple in having two basic requirements. The first is the submission of a data management and sharing plan, and this is for all NIH-funded research. A data management and sharing plan is an indication where researchers describe how they plan to manage and share their data, where they plan to manage and share their data, and by which timelines. And then the second major requirement is to follow through with the plan as approved by the funding institute or center. We have indicated in the policy that non-compliance with these requirements may affect future funding. And as I noted, that this policy went into effect on January 25th of this year and replaces the earlier 2003 NIH-wide data sharing policy. So this policy applies to all research regardless of the funding requested, and all research generating scientific data, including but not limited to research projects, some different career development awards like CAES, SPIR, STTR awards, research and research centers. The DMS policy does not apply to research projects that do not generate scientific data or are not focused on research itself. So that includes training as well as fellowships and infrastructure, for instance. We have on the sharing website that Cindy will introduce a little bit later, there's a more complete list of which activity codes are subject to this policy. Which scientific data or which data is to be shared? The policy itself indicates that all NIH-supported research generating scientific data is to be included in a data management and sharing plan. So that the definition here of scientific data is recorded factual material of sufficient quality to validate and replicate research findings, regardless of whether the data are used to support scholarly publications. And so this includes a variety of different data types, all of which NIH funds, and may include qualitative data as well as data resulting from fundamental basic science techniques. We had specific questions about those, and we have specific FAQs related to those specific kinds of data types as a result that are also available on the sharing website. In the policy, we also indicate what are not considered scientific data, including lab notebooks, preliminary analyses, case report forms, peer reviews, and physical objects, including biospecimens. Ultimately, what is considered scientific data on a project-by-project basis is up to the discretion of the investigator, but we do encourage the investigators that are wondering what might be the appropriate scientific data for their project to have a conversation with their program staff. The policy also provides timelines on when to share data and how long to share data. In terms of when to share data, the policy indicates that data should be shared no later than time of publication for data that are underlying peer-reviewed journal articles, or the end of the award for data that are not published. In terms of how long to share data, the policy does not indicate a specific length of time. Rather, it points to other relevant requirements and expectations. For instance, if an investigator is submitting to a particular journal, that journal may require the data to be shared first for a length of time, or based on the repository selected, that may kind of dictate how long the data should be shared. Policy also provides additional expectations for data management and sharing plans, and emphasizing that data sharing should be the default practice, and that data sharing should be maximized whenever possible. However, the policy also recognizes that there are justifiable limitations to not sharing data. These are generally categorized as legal, ethical, and technical limitations, which I will discuss a little bit later. All data should be managed, but not all data should be shared. And the policy emphasizes that plans should be responsibly implemented, and that plans should outline how participants' privacy, rights, and confidentiality are protected in ways that abide with existing laws, regulations, and policies. The policy really emphasizes prospective planning for data management sharing, in that these plans are submitted at time of application, and that this prospective planning should then be considered at all stages of the research process. With regard to potential limitations on data sharing, again, the policy emphasizes that sharing should be maximized as appropriate, but allows for some limitations that can be ethical, legal, or technical in nature. And specifically in frequently asked questions on the sharing website, we specify that informed consent may be a reason for limiting data sharing. Also, that privacy, if there's a reason that participants' privacy or safety would be compromised by data sharing, that would be a justifiable reason. Or if there's explicit federal, state, local, or tribal laws, regulations, and policies that prohibit disclosure, or if there's a restriction that's imposed by existing or anticipated agreements with other research parties, and instances in which data sets cannot practically be digitized with reasonable efforts. The frequently asked question also provides some reasons that are not considered justifiable reasons to limit data sharing, as well as additional considerations. For instance, NIH respects tribal sovereignty, and in support of responsible management and sharing of American Indian, Alaska Native participant data, this might be a reason for limiting data sharing and for affecting the way data can be managed. For instance, which data repository can be selected and by whom that is actually managed. We also note that SBIR, STTR program policy directive permits withholding data for 20 years as stipulated in agreements and consistent with program goals. So that's another reason that may be a justifiable limitation to data sharing. Alongside the policy, we've released a number of supplemental information documents, the first of which are elements of a data management sharing plan. These are recommended elements to include in a plan. The first is data type, so which data and metadata are anticipated to be preserved and shared, and the rationale for doing so. The second, an indication of tools and software needed to access and manipulate data. Third being any standards that will be applied to the scientific data and metadata. The fourth being where the scientific data will be shared, through which repository, and a persistent unique identifier associated with that, as well as timelines related to data sharing. The fifth being a description of factors for data access, distribution, or reuse, including if a data will be controlled in its access. And the sixth is oversight of data management. So this is an indication of how plans compliance will be monitored and managed, and by whom. We have not indicated the type of party that should be listed here. However, I'll note that some institutes and centers are interested in this element as a potential way to incentivize, or as a potential way to credit particular members within a team who are involved in data management and sharing. NIH has also provided an optional format page that is incorporated into the Forms H application instructions and available as well on the website. Plans are generally recommended to be no more than 2 pages of links. There is some flexibility to this, as we understand that that some projects are proposing many data types, or some projects are just very large in nature, and that may not be feasible for plan length. Also, NIH is undergoing a pilot project with the Federal Demonstration Partnership currently to test some more structured plan templates. Another supplemental information document that was released alongside the policy is related to how a researcher might go about selecting an appropriate data repository. And this is to encourage researchers to use established repositories, and it provides a number of different characteristics of a repository that would be good for sharing data, including things like a repository that uses persistent unique identifiers, attaches metadata, and it assures QA/QC, for instance. We will note that specific institutes and centers around NIH may designate the use of particular repositories, and that may be an additional expectation beyond the data management sharing policy. Not a supplemental information, but closely related to this policy, NIH released a resource for informed consent last spring, and this resource is intended to help researchers and institutions establish robust consent processes. So this is not intended to be a template, but rather for voluntary use, and it is not intended to establish additional consent expectations or require broad consent. Rather, it's for points to consider for researchers and in their institutions, as well as sample language that may be helpful for including informed consent related to future use and or data sharing. I'll note that this resource is focused both on data and biospecimens. The data management sharing policy, in contrast, is only scientific data is subject to the data management sharing policy and not biospecimens. We also more recently released a supplemental information on protecting privacy when sharing human research participant data, and this provides a basic framework for considering how to protect participants' privacy when sharing data, when sharing human data. This is not intended to be a guide for regulatory compliance, but rather provide operational principles and best practices for protecting participant privacy and for determining whether to control access to data. alongside that supplemental information, we also released a supplemental information specific to responsible management and sharing of American Indian Alaska Native participant data. This is to be information for researchers specifically, and to assist them in their development of appropriate data management sharing plans when they are proposing to do work with these communities. This supplemental information was developed through recommendations of from the 2019 tribal consultation, and it really emphasizes the importance of tribal sovereignty and why researchers and the NIH should respect tribal sovereignty. And it introduces also the importance of partnering partnerships between researchers and American Indian Alaska Native tribes from the development of a data management sharing plan prior to research, throughout the research project and beyond, and provides some best practices on building trust between these different parties. With that, I will hand the baton to Cindy, who will tell us a little bit more about an additional supplemental information on allowable costs.
Thank you, Ellen. So I'm part of the NIH Office of Extramural Research, and some of our roles in implementing this policy include making sure that the grant application forms and systems are updated to capture the information we need. And another role within our office relates to costs. We do have the Grants Policy Office, who are, have the expertise in terms of what are considered allowable costs. And so, as Ellen mentioned, we at the NIH did put out some supplemental information alongside the policy related to allowable costs. And this provides information on what types of activities proposed in a data management and sharing plan might be considered reasonable costs allowed in your budget requests. For any sort of direct costs that are going in your budget request, these must be incurred during the performance period. And as it relates to data management and sharing, these might be considered allowable costs if they are for us going to be supporting activities related to curating data, developing supporting documentation, preserving and sharing data through repositories, as well as local data management considerations, so getting your data ready to share. There are some types of costs that might be relevant to data sharing, but would not be considered a direct cost for your budget request. And that would include infrastructure costs that are already covered in your indirect costs, as well as costs associated with the routine conduct of research. So for example, requesting and gaining access to others' research data that have been shared. In terms of what the actual costs will look like over time, NIH does hope to learn more about what constitutes reasonable costs for various types of data management and sharing activities. Next slide, please. So now I want to give a quick overview of what the process looks like for submitting data management and sharing plans and that budget information, and then how that will be reviewed. So in terms of plan submission, your data management and sharing plan is part of your application, and there will be a brief description of that plan, as well as some budget information that's part of the budget justification. But the full plan, which is expected to cover those recommended elements and will be about 2 pages long, that will be submitted as a separate attachment. Once the plans are submitted with your application, and first of all, in terms of peer review, peer reviewers are going to have access to that budget information, and they're able to provide any comments on whether that budget is reasonable, but this will not impact the score. And peer reviewers are not responsible for reviewing the data management and sharing plan. Rather, it's NIH program staff at the funding NIH Institute Center or office who will be assessing those plans to determine whether they are acceptable. There is the opportunity to revise plans if needed. And so if there are any issues in approving the plan that was provided with your application, then you will hear from NIH staff who would reach out to let you know if any additional information is needed so that your plan can be approved. And that really is the goal. If there are any issues, then NIH would want to work with you to make sure that that can be updated in a manner that can be approved and works for everyone. Once an award is made, then the approved data management and sharing plan will be incorporated into the terms and conditions of your award. And then the adherence to that plan will be monitored at regular reporting intervals. This will be done as part of the progress report process. And so we are working on making updates to the RPPR to make it clear what type of information NIH needs on an annual basis to support that oversight. And as Ellen noted earlier, compliance with that approved plan may factor into future funding decisions. Next slide, please. I want to give just a few kind of high-level updates just to point out where information will be submitted and the applications, because there have been some changes to accommodate this information. And the current version of the grant application forms is called Forms H. These are in use now for competing applications. And we do have detailed instructions which are available in the application guide, which will be able to answer really most questions that you might have. But briefly, there has been a new field added specifically for the data management and sharing plan. This new field is called Other Plans, and it follows right after the existing resource sharing plans field. And so one change for anyone who might have been subject to the previous data sharing policy or to the genomic data sharing policy, you'll no longer submit those separate attachments under the resource sharing plan section. Instead, any plans, data management and sharing plans will be submitted as one attachment to the other plans section. And if your research is also subject to the genomic data sharing policy, you'll incorporate that information as part of that single data management and sharing plan rather than providing two separate plans. Next slide, please. So the resource sharing plan field, that is not going away, that will continue to exist. And we have certainly gotten some questions about, when do I have to use this field? Do I ever have to submit plans to both places? And you'll only submit something to the resource sharing plans field if there is an additional sharing policy that you're subject to. For example, if you're developing research tools or model organisms, then you need to submit a plan there. Or if there are specific instructions in your funding opportunity announcement indicating that another type of sharing plan is required there. Otherwise, if you are conducting research, generating scientific data, then in most cases, you'll simply submit a data management sharing plan attached to this new other plans field. And we do realize that this is a change compared to the previous workflows. And so we have put in place validations to make sure that if you are required to submit a data management and sharing plan, that you'll get an error if you try to submit your application without it, to make sure things are going in the right places. Next slide, please. So once you have written up your data management and sharing plan and have a sense of what activities you'll are planning to conduct to manage and share your data, then you'll need to think about what sort of budget you might need to request to support those activities. And when you have that figure, the direct cost to support the activities proposed in your plan will be indicated in a line item if you have a detailed budget. And for modular budgets, which do not have line items, that information will go within the additional narrative justification. Next slide, please. In addition to the actual dollar amount that you're requesting, you'll also submit a brief summary. And that summary will contain two pieces of information. One, a brief summary of the DMS plan, kind of giving a sense of roughly how much data are you generating and where is it going, and also a description of the costs. So what type of activities will be incurring costs. And this information is going to be available to peer reviewers, and they would use this to comment if needed on any requested DMS costs based on this information here. Next slide, please. So next I want to shift and let you know where you can find information, the type that we're telling you today, as well as information about other sharing policies. NIH has a scientific data sharing website, and you can access this at sharing.nih.gov. And this is a central source of guidance related to multiple NIH data sharing policies, covers the data management and sharing policy, which we're focused on today, And it also covers other NIH-wide policies, including the genomic data sharing policy, model organisms, and research tools sharing policies. And as new information is available, it will be updated on the site to make sure it is the first stop for where you can get up-to-date information. Next slide, please. Some resources that I want to highlight here relate to planning and budgeting for data management and sharing. And we have content focused on writing a data management and sharing plan, as well as budgeting. And we do provide access to the instructions, those detailed application instructions, which you'll want to look at here as well when you're preparing this information. Next slide, please. As I've mentioned, there are multiple sharing policies, and depending on what work you are proposing, you might be subject to more than one sharing policy. So we have information to help explore and understand what policies exist. And next slide, please. Also a tool to help you understand which policy a particular application might be subject to. And so the tool walks you through thinking through what types of outputs your research will generate to give you a sense of what policies might apply so you can begin preparing for that ahead of your application. Next slide, please. And with that, I'm going to turn it back to Ellen to talk about some more resources available on this website.
Thank you, Cindy. In addition to the many resources that Cindy has introduced, we also have some example or sample data management and sharing plans. And these are plans that were developed by institutes and centers across NIH and discuss a variety of different data types, both human and non-human. So some of these are from institutes including NIMH, NHGRI, NIDDK, and NICHD. In terms of how to get started in developing a data management and sharing plan, you might be wondering how to start. And we recommend first identifying existing resources within your institution. So for instance, many institutions have data librarians and repositories that are quite helpful for resources locally. Also, please reference these examples from relevant sample plans on the sharing website, as well as the other information there. And then just go ahead and try to draft a data management and sharing plan based on the recommended elements with thoughts of kind of what are current data sharing practices based on NIH's other data sharing policies or other funder policies, as well as publisher expectations, and what might need to be updated for compliance with this new policy. We also encourage you to carefully read the funding opportunity announcements as specific institutes and centers and programs may have additional requirements specific to data management and sharing. And with that, I would like to ask our librarian, Lisa.
Thank you. So I want to talk a little bit about the role of librarians in helping with this policy, and also speak to, I know we have some librarians in the audience, talk a little bit about some training opportunities that are available. So first of all, as Ellen mentioned, many institutions do have a data librarian or more than one who specializes in data management, data sharing, metadata, controlled vocabularies, lots of different things that might be useful in thinking about what you might plan for in terms of data management and sharing. Many of these librarians also have actually some sort of disciplinary expertise, so they can be a great resource. Not every institution has a dedicated data librarian. There are also liaison librarians or subject specialist librarians who probably don't have that sort of deep data expertise, but they may have some familiarity with things like what are the repositories or standards that are commonly used within a discipline that they are working with. So that can be an option as well. And then some institutions also have scholarly communications librarians who specialize in things like licensing. And so they may be able to provide guidance on selecting a license for sharing data if that is something that you are looking at. Next slide, please. So a lot of librarians already have some significant expertise in this area, but a lot also have more things to learn. And so I do want to talk about a couple of different resources. One is the network of the National Library of Medicine's National Center for Data Services. So the NLM has this network of regional medical libraries that is around the country, and also this special center for data services. That center is providing training designed for librarians in many areas related to open science and data sharing, and lately in particular with regard to this policy. Next slide, please. The NCDS also maintains a set of resources that are intended for librarians, but may also be helpful for you if you are a researcher looking to learn a little bit more about some of this. For example, they have a data management and sharing policy toolkit that was developed by librarians, and a data glossary, and some other resources that may be helpful in thinking about what goes into a plan. Next slide. I also want to mention the Data Curation Network. This is a network of libraries and institutional repositories that is working together to create a network of curators advancing open research by making data more ethical, reusable, and understandable. So the idea with this is that if you are a member of the DCN and you're a curator or a librarian, you may have particular subject matter expertise in a specific area. And if someone from a different area comes to you, you may not know how to deal with that specific data. And so you would reach out to this network and connect with somebody else at a different institution who is familiar with that, and kind of trade your services in that way. The DCN also has put together quite a lot of training to help get more people aware of how to properly curate and manage data. Next slide, please. They focus their training and their approach to curation of data with what they call the curated model. So their process would be to check the files, understand the documentation that goes with the data set, request any missing information from the data submitter, augment the submission if needed with additional information that would be needed for understanding, transform the format when necessary, evaluate the data set for fairness, which is the extent to which the data is findable, accessible, interoperable, and reusable, and throughout this whole process to document everything. So they have some useful resources on their site and do provide training if you're interested in learning a little bit more about that. And if you are a researcher and have the opportunity to work with a curator or a librarian that has some of this expertise, I recommend taking advantage of that. I think it can be really helpful to have a second set of eyes on things that might catch something that you wouldn't necessarily think of, since you're so, involved in your data. To get somebody that is sort of an outside set of eyes, I think can be really helpful. And with that, I will pass it back to Ellen.
Thank you, Lisa. The Office of Science Policy and the Office of Extramural Research had a blog last year that provides a general roadmap of kind of what to expect going forward in terms of implementation of this policy. But we have a number of resources that have been mentioned that are currently available on the sharing website, including there's 2 public webinars, and the recordings of those are available on the sharing website, in addition to FAQs and various supplemental information, and a notice about the harmonization of the genomic data sharing plans with the data management and sharing plans. Also going forward, we do anticipate continuing to populate the website with additional FAQs and guidance as needed. And currently we're in the process of thinking through how to evaluate the policy in terms of short-term goals of whether these plans are actually being submitted with sufficient information, and then if there's compliance with the plans, as well as long-term goals of if this policy is resulting in additional data citation and reuse of data. And then we're also hoping to think through and provide more incentives for data sharing. So I'll note that, for instance, this policy, while it does not apply to trainees, for instance, all researchers can benefit from incentives to data sharing. And for instance, providing clarity on how and when to cite data in NIH processes and things like that. Also going forward, our next steps will be largely directed by this White House memo that came out earlier this summer on public access, which directs federal agencies that support research to develop plans in 3 areas. So this is for publications resulting from federally funded research, to make those publications freely available and accessible at time of publication without embargo. And the second part of this this directive is with regard to scientific data and making scientific data underlying publications accessible at the time of publication, or scientific data not underlying publications to have an approach for that. So we largely view this data management sharing policy to be consistent with this this part of the memo. We don't anticipate changes in this policy in the near term as a result. And then the third part of this memo that will kind of shape our next steps is related to collection and sharing of appropriate metadata for publications, and digital persistent identifiers for publications, data, researchers, and awards. And so we are currently in the process of submitting a plan for and a response to this memo to OSTP as well as OMB, and we plan to go out for public comment on these implementation plans in the near future. With that, I would like to thank you for listening today and provide some resources that we have referred to today in today's lecture. We will make these slides available to you, so these links will then be available that way, and open the floor for questions. Thank you.
Hey, thank you all for your wonderful presentations. You certainly gave us a lot to think about. We're so appreciative of these resources that you've shared with us. Of course, you can imagine we've generated a number of questions for you. So I'll just start from the top here, and whoever is best suited to answer, please go ahead. So the first one here is, what advice do you provide to manage privacy risk?
In terms of managing privacy risk, I would refer to the various best practices of the supplemental information and basically those are as I said, best practices. So they're not a guide to regulatory compliance, but rather provide information on, even when data are de-identified, how to share that data responsibly, and consider things like whether data should be controlled.
Thank you. All right, next, if a study involved medical radiology images, would the patient's medical images need to be released or just summary information from spreadsheets?
So I think this, any specific questions related to particular data types, I think largely is dependent on the study itself, of what data is consistent with the definition of scientific data. However, if there's a concern about patient privacy, for instance, in such images, that would be something that could be a justifiable limitation to data sharing, and that would be something that a researcher would then want to describe in their plan as to why they may not be sharing that data.
Okay. And we have two questions here that I'm going to kind of combine regarding clinical trials. So the first is, are there instructions for data sharing for human clinical trials? And the other one asks how the policy in general applies to clinical trials. Do clinical endpoints, for example, response rates, need to be shared in a space other than the publication? It's not clear to the questioner where that would be done after looking at all of the resources posted.
So generally speaking, we are encouraging the sharing of data through an existing repository, if possible. And we do provide some examples of NIH supported repositories that may be appropriate to your data type. But there's also kind of a list of additional repositories that may be worth looking at here. In terms of instructions for clinical trials specifically, we do not provide particular instructions for that, but we do have those examples of data management and sharing plans and what they look like. Some of those discuss clinical data, and so I would refer to those sample plans that are available.
And by what process will the compliance of the data management sharing plans be reviewed or enforced, say through independent reproducibility checks? And if there is compliance, non-compliance, will that impact future funding successes, say trusted labs / grants?
I can take that one. So in general, compliance with the approved data management and sharing plan will be handled similarly to other aspects of compliance. And so this will be examined on an annual basis based on information received from the recipient. And if there are any issues with non-compliance, then just like other cases, NIH does aim to work with the recipients to resolve those. But if there are serious issues, the policy does indicate that there can be various recourses, but really the goal is that the NIH will work with you to make sure that you're able to comply with your plan that you have written and that was approved. And if there are any issues, then hopefully work together before they turn into issues, and certainly to resolve anything before the end of the award period.
Okay, thank you. What data sharing elements need to go into the budget justification?
Yeah, good question. I can take that as well. And I can pop into the chat in a moment a link to a frequently asked question. We have recently added some specific to budget and costs, and that answers that question well. And it really just points to the application instructions. And so there's kind of two pieces of information there. One is a summary of the plan, and specifically a summary of the type and amount of scientific data to be preserved and shared, and the name of the established repository where they will be preserved and shared. And that information is really, context for the peer reviewers. And in addition to that context, we also ask you to indicate the general cost categories, such as curating data and developing supporting documentation, local data management activities, preserving and sharing data through established repositories, et cetera. And those are those categories that NIH had indicated in that allowable cost supplemental information. And so you include an amount for each category and a brief explanation. And this will be, roughly expected to be about half-page long, really focusing on the cost and making sure there's enough information to allow reviewers to comment on that as they do other aspects of the budget.
Okay, and you may have started to touch on this here. For this next question, costs for preservation repositories are allowable, which is great. However, long-term access will require long-term payments to cover the cost. Is it possible to use grant funding to pay for long-term storage several years ahead beyond the duration of the grant?
In that notice on allowable costs, we did indicate that all costs must be incurred during the performance period. And we are certainly, aware that this kind of culture change here with planning to make data available will, require some thinking of exactly how that needs to be handled. So we don't have any additional information at this point, but if you do have cost-specific questions, you can reach out to our grants policy office at grantspolicy@nih.gov, and they are, the ones who can respond to any cost and budget-specific questions. And beyond that, we do hope to hopefully be able to provide some more information on how to handle that potentially in the future.
Could you elaborate on why DMS plans will not be visible to reviewers? Shouldn't they be reviewed like all parts of grant proposals?
So I can start on that one. And this was one decision that was made on the development of the policy, and that final policy as published did indicate that peer reviewers would not be assessing the merits of the plans, but this would be done by, programmatic assessment by the NIH staff at the Institute or center who's funding it. And, some rationale for that, it was indicated in the preamble to the policy, and some benefits include, consistency of review by NIH staff, tying things to the compliance monitoring process. So I guess that's kind of the background there. And I don't know if there's anything else that would be helpful to indicate, Ellen, if you have anything more, but really that this is the role of program staff to determine if that meets their programmatic needs and if it's acceptable for the area of science proposed.
Okay. So I see we are just about at the hour. We weren't able to get to everyone's questions, but thank you so much for submitting some real thoughtful ones. Again, I want to say and encourage any of our UChicago researchers, if you have more questions, if we didn't get to your question today, please reach out to datasharing@uchicago.edu. I just put that email in the chat so we can get back to you with those answers. Other attendees, please reach out to your support services at your own institutions. We do plan to make the slides and the recording publicly available, so look for that coming out soon. Lisa, Cindy, and Ellen, thank you so much for your time and your expertise today. It was really a pleasure to hear from you and to learn about all of these wonderful resources. So this is going to conclude our session for today. Thank you all so much for attending, and take care.